Assalamu alaikum. My presentation topic is drug oxytocin, and I introduce myself. My name is Mahwish Hamid, having roll number 1550113. I am a student of final year morning. My presentation topic is oxytocin. Now, what is oxytocin? We know that oxytocin is a peptide hormone which is secreted by posterior pituitary gland. And oxytocin stimulates the muscle contraction in the uterus and myoepithelial contraction in the breast. It also involves the partitioning and letdown of milk. During second half of pregnancy, uterine smooth muscle shows an increase in the expression of oxytocin receptor and become increasing sensitive to stimulate the action of endogenous oxytocin. Now we have short mechanism of action of oxytocin as how it works. We know that oxytocin work by increasing the concentration of calcium inside the muscle cells. That inside the muscle cells that control the contraction of the uterus. Means inside muscle cells inside the muscles we have calcium which is control the contraction of the uterus. Increase calcium, increase the concentration of calcium, increase the concentration or increase the contraction of the uterus. Now we have rational use of and irrational use of oxytocin. In rational use, we know that it is used to induce labor and also used to control the BPH in women. But its irrational uses are very harmful in our society as it is used by farmers. They they give injection of oxytocin to the cows to increase their production of milk. Now we have the indications. It is indicated for the prevention of postpartum hemorrhage, also indicated to accelerate the abortion. It is also used to stop the bleeding following evacuation of uterus. Now we have drug interaction. No common drug interaction is found in oxytocin. And indication now second slide is adverse effect. We have adverse effect of oxytocin, such as sinus bradycardia, tachycardia, neonatal seizures, neonatal jaundice, fetal death, and here are many adverse effects. Now we have drug toxicity with mechanism. Dosage as administration. Now its dose vary, but for different condition means for induction of labor, initial rate of infusion is 0.5 to 2 microunit per minute is increased every 30 to 60 minutes until a physiological contraction of pattern is established. The maximum infusion rate is 20 mU per minute for postpartum uterine bleeding. 10 to 40 units are labeled to 1 liter of 5% dextrose, and the infusion is titrated to control the uterine atony. Alternately, 10 units of oxytocin can be administered by IM injection. Route of administration can be administered IV and intramuscular and intranasal. We have alternative choice of oxytocin is misoprostol. Now here are some brands of oxytocin. Now we have case study. A woman attend to a routine attendant appointment at 31 weeks of gestation. She is 26-year-old and this is her fourth pregnancy. She has 3 children, all spontaneous vaginal deliveries at them. Her third child is 18-month-old and the delivery was complicated by a postpartum hemorrhage requiring 4-unit blood transfusion. This pregnancy has been uncomplicated to date. The normal booking of blood test, normal 11 to 14 weeks of ultrasound and normal anomaly ultrasound scan. Now here are some soap notes. Subjective as mother experience the fatigue, dizziness, increased risk of hemodynamic compromise. Now we have objective. Now we have investigate the blood report at 28 weeks, hemoglobin is 7.8, which is very less. And main cell volume is 68, which is also less. On assessment, we have in assessment, the hemoglobin is significantly low. Even for pregnancy, it is very hemoglobin count is very low. So then we have to assess the patient, ask the patient to take iron-rich diet, and also indicate or assess the patient that she should take ferrous sulfate 200 milligram twice daily. But if then hemoglobin level not rise, then we should transfuse the blood should be considered. Now we have a plan. As we know, at time of delivery, blood loss is irreversible, and we know woman is anemic, having having low hemoglobin level. The women have additional risk factor of having her fourth delivery and having history of PPH, postpartum hemorrhage, as she is already anemic. So at the time of delivery, we should physician should be considered. Active management of third stage is essential, and oxytocin infusion considered if bleeding is excessive, as IV infusion of oxytocin reduce in bleeding. Oxytocin should be like this, that we should start with 5 units slow IV or IM, infuse then 20 units in 1 liter with the rate of 60 drops per minute. Continue the same dose at the rate of 40 drops per minute unit bleeding until bleeding stops. We continue the infusion of oxytocin. As women, we know that the woman is already anemic, and he has the history of postpartum hemorrhage, so she's already anemic, and then we should arrange the blood also in case of emergency to transfuse, and also oxytocin to control the postpartum hemorrhage, as it is the main indication of oxytocin that it controls the postpartum hemorrhage of uterus. Now here are the references of I take the presentation topic, and I take the case study and presentation from the social media sites and the book Katzung and Lippe, and from the PubMed and different social media sites. Thank you. Jazakallah.